Hello everyone, my name is Mayur. I'm a master's student at the Medical Image Analysis Lab of Simon Fraser University. This work with Dr. Gasan Hamarne, titled Deep Multimodal Guidance for Medical Image Classification, has been accepted to the MICCAI 2022 conference in Singapore. Let me explain the terms in the title. Firstly, we have medical image classification. Given the images of a diseased organ of a patient, the goal is to identify the disease present in it. To do this, we make use of deep learning, where we use end-to-end trainable models to map from the image space to the label space. Multimodal is an important aspect of medical imaging, where the clinician looks at multiple modalities of data before drawing diagnostic conclusions. In this case, we have multimodal datasets of brain tumors and skin lesions. The final term in our title, guidance, is something that is specific to our contribution. The main motivation for guidance is the prevalence of a trade-off between the acquisition of a particular modality and the information it delivers. In simple terms, the easier the acquisition of a particular modality, the lesser the information it provides. For example, let's take the brain tumors from the MRIs and the histopathology. The acquisition of MRI is relatively simpler, as it is a non-invasive procedure which takes around 30 minutes, whereas the histopathology involves invasive biopsy, which is usually followed by a sequence of tedious steps. When it comes to the information, the histopathology is considered to be the golden standard. Similarly, in the case of skin lesions, we have the clinical images on the left, which are acquired through ubiquitous consumer-grade cameras. And on the right, we have the dermoscopic images, which require an expensive dermoscope as shown here, and also trained clinicians. And similar to the previous case, the expensive modality provides more information regarding the disease. To summarize, we have two modalities, the inferior and the superior. And with guidance, we want to make use of this existing multimodal data in order to improve the performance that is achievable with the inferior modality. In deep learning language, we make use of multimodal data during the training, but we only have access to the inferior modality during the inference. Moving to the methodology, we start with two independent modality-specific classifiers, one for the inferior modality and the other for the superior. We then train the guidance model to map from the latent space of the inferior modality to that of the superior. We incorporate the trained guidance model in the classification framework of the inferior modality so as to have a superior classification from the inferior data. And finally, our proposed guided model, we concatenate the two latent representations to have a multimodal classification. In our experiments, we make use of two datasets. Firstly, the RADPath, which contains 221 paired images from radiology and pathology. Secondly, we have the DERM 7-point dataset, which has around 1,000 paired images of clinical and dermoscopic skin lesions. We compare 5 models. Firstly, the superior modality model, the inferior modality model, the multimodal model, which has access to both modalities during inference, the guided model, and finally the proposed guided model, where we concatenate the two latent representations. Note that the last two models only have access to the inferior modality during inference. Based on our experiments, we observed that the superior modality outperforms the inferior modality in almost all the cases, which is as expected from the clinical setting. Then we have the multimodal model outperforming the superior modality model, which implies that the inferior modality adds valuable diagnostic information to the multimodal data. Then we have our proposed guided model outperforming the inferior modality model, which is the contribution of our work. The improvements in the case of our proposed guided model, in case of the multi-sequence MRI of RADPath, are comparable to that of the multimodal model, which means that the guidance is able to replicate the superior modality. In conclusion, we propose a novel method to solve a clinically motivated problem. In this work, we leverage this existing multimodal data in order to improve the performance that is achievable with the inferior modality. And our results show that the future works could aim towards mitigating the expensive acquisition of the superior modality. Thank you for listening. If you're more interested in this work, please check out our codes on GitHub and archive. Thank you.